All right, Dr. Scholz, so our first question is, what should a person's PSA be after radiation? I know this is a common question. Maybe it's different types of radiation. What should it be?
So there's a time component, because radiation, people mistakenly believe that it burns the cancer out, and so the PSA should go down because it killed the cancer. But the problem is that it doesn't work that way. What it does is it poisons the cancer cells, and when they decide to divide down the line, 6-12 months later, that's when they decide to die, and that's when the PSA goes down. So the PSA slowly declines after radiation, down to about 0.5 over a 6 to 24 month period. It varies quite a bit from patient to patient. Now, that, of course, is based on the idea that they're not getting some hormone treatment. If people get hormone treatment with radiation, as they often do, PSA will plummet to undetectable levels, usually within a couple months. And then I've seen people get nervous about rising PSA after radiation when they stop their hormone treatment. So the PSA has been less than 0.1 all the time on hormone therapy, and then the hormone therapy stops, the testosterone returns, and then the residual prostate gland will make a little bit of PSA, and the PSA may go up to 0.2, 0.3, 0.4, making everyone really nervous about the possibility of cancer, when really it's just to be expected based on the fact that men that undergo radiation still have a prostate, and they're still making a little bit of PSA. So short answer, the PSA should probably be from 0.2 to 0.5 a year or two after the radiation. That would be a normal PSA. That would be consistent with a complete remission.
Okay. And after radiation, how many times in what time frame should the patient get the PSA checked? So do they get it every 3 months, every 6 months to check that?
Mm-hmm. So usually we do it on an extending program. After the radiation therapy is completed, we will check the PSA every 3 months for 2 years. And then for the ensuing 3 years, out to 5 years, we'll check it every 6 months, and then once a year after that.
Okay. And after radiation and, the PSA is continuing to decline and you may see that bump, is there any imaging that the patient does within those year time frames?
Well, that's one of the really cool things about PSA is that if it's behaving the way we want it to behave, you don't need imaging like you would with a lung cancer, colon cancer, breast cancer. Prostate specific antigen for prostate cancer is really accurate. The exception is something you mentioned in passing. You mentioned the word bump. PSA bump after radiation is thought to be due to delayed radiation inflammation. We call it prostatitis. The PSA bump phenomena is more common in men that get fast radiation. So more and more men are doing something called SBRT, stereotactic body radiation, where they get the radiation in 2 weeks. And for some reason, that equates with more delayed prostatitis, which can occur anywhere from 1 to 4 years after the radiation and cause a temporary rise in PSA, not from cancer, from inflammation. And historically, we just had to sit on our hands and worry and try and figure out what was going on. Now with these new PSMA PET scans, when men's PSAs go above 1 or 2, we'll think about getting a PSMA PET scan and make sure there's no cancer. But PSMA bumps are common after SBRT. They're common after seed implants. They occasionally will happen after proton therapy and IMRT as well. So just because the PSA goes up a little bit, don't jump off a bridge. It's time to evaluate what's going on, not just assume that it's a cancer coming back.
And the common time frame that you may see a PSA bump is within any time frame a year after, or?
Anywhere from immediately after the radiation out to 3-4 years after the radiation.
Gotcha.
Yeah.
Thank you. Thanks for watching. If you would like more information about any of the topics we discussed today, go ahead and visit our website, PCRI.org. Also, please subscribe to our YouTube channel and give us a thumbs up. We really appreciate it.